After taking a huge toll on India, the highly infectious Delta variant is now spreading rapidly in other parts of South Asia too. Nepal, Pakistan and Bangladesh have been the most affected, with Himalayan countries' health system now strained to a level where it cannot accommodate any more patients. A slow vaccination due to unavailability of doses has only worsened the crisis. Pakistan, on the other side, is grappling with a completely different challenge of vaccine hesitancy, as people influenced by rumours and conspiracy theories are unwilling to take any jab. The government in such a scenario has no option but to arm twist and get the job done.
Hospitals in the Himalayan nation's capital, Kathmandu, are left with limited beds. Those equipped with oxygen are even lesser in number. The government was gradually relaxing the weeks of lockdown, but the highly infectious Delta variant, which took the daily tally to 3,000 cases in a day, forced authorities to take strict measures once again. To stem the spread of the virus, they have extended it by 2 more weeks.
दोस्रो लहरको कारण चाहिँ निकै नै संक्रामक भाइरस थियो, जसलाई डेल्टा भेरिएन्ट भनिन्छ। डेल्टा प्लसहरू नेपालमा भेटिएको हो। दोस्रो लहर ल्याउने कारण नै त्यही थियो। निषेधाज्ञाले कर्भलाई अलिकति फ्ल्याटनिङ गर्यो, तर त्यो संक्रामक भाइरस समुदायमा रहिरहेको अवस्था थियो। संक्रमितहरू समुदायमा रहिरहेको अवस्था थियो र निषेधाज्ञा खोल्दाखेरि जुन हिसाबले मानिसहरू बाहिर निस्के, मापदण्ड अपनाएनन्, त्यसको कारणले गर्दाखेरि यो संक्रमण बढेर गयो। हामी संक्रमणको सङ्घारमा छौँ। संक्रामक भाइरस हामीसँग रहिरहेको अवस्था छ र हामीले मापदण्ड नअपनाउने भने, अझै सजग नहुने भने अझ धेरै व्यक्तिहरू संक्रमित हुने देखिन्छ।
With fear seeping in and some vaccine batches reaching the country, a large number of them could be seen standing in long queues and others rushing to get into a vaccination center. There have been communication gaps between authorities and people during the local rollout, fueling confusion, local administrative bodies said. Nepal had earlier introduced an online registration system to book slots for vaccination, but the government reversed it for easy and equal access to vaccines. Meanwhile, similar scenes also emerged in Pakistan, where massive crowds gathered at the vaccination center after the government warned it would penalize the unvaccinated. Pakistan's federal government has announced that it would block unvaccinated workers from entering public offices, schools and restaurants, while the general public will be banned from transport, shopping malls and air travels without vaccination certificates. The provincial government in Sindh has been particularly strict for it and has warned people with withholding of salaries and blocking of people's cell phone SIM cards unless they have the required certificates.
मैं पर्सनली कोरोना से डरता नहीं, लेकिन गवर्नमेंट ऑफ सिंध के कुछ इक़दामात ऐसे हैं जिसकी वजह से मुझे वैक्सीन लगानी पड़ी, क्योंकि हमारी सैलरी रोक दी जाएगी, हमारी सिम बंद हो जाएगी, ये सारी चीज़ें चल रही हैं। इस वजह से आज मैंने अपनी सेकेंड डोज कंप्लीट कराई है। बहरहाल मैं कोरोना से डरता नहीं।
According to National Command and Operations Center, a military-run body that oversees the COVID-19 operations, out of a population of 220 million, Pakistan has managed to inoculate 31 million shots. Out of this, only 6.7 million have been fully vaccinated. Pakistan's vaccine procurement programs are largely dependent on China's export or through the COVAX program. In another South Asian country, Bangladesh, ambulances in the capital Dhaka have seen a surge of activity as the number of COVID-19 cases jumped, fueled by the Delta variant. Following a brief suspension of the lockdown for the Eid al-Fitr holiday in July. Bangladesh ordered a 15-day lockdown again from July 23rd, and many poor, jobless and daily wage earners are struggling to make ends meet. Some rely on handouts for food. Meanwhile, India, which is consistently inoculating nearly 5 million doses per day, hasn't got complacent despite 10 times decrease in the average number of cases as compared to the second wave peak it suffered in the month of April and May. Apart from western state of Maharashtra and southern Kerala, the country has been gradually stabilizing. But the authorities have warned people to not let their guard down, for the second wave, they said, was still not over in the country.